into it because she wanted to have a positive impact on the lives of people. So when I hear that an independent task force says that the mammogram guidelines are wrong, I wish they were here to hear some of this. And then there's always a ringer. There's a woman, they'll get a woman to come up and talk about women's issues. And that woman says, well, you know, she's vice chair of the group, and she explained that, you know, women would rather decide on their own and with their physicians whether to undergo regular screenings. That's not what I've heard all these years. If you've ever found a lump in your breast, if you've ever had an unusual vaginal discharge or an abnormal pap smear, you know the feeling. You don't want to go in there and discuss. You want to go in and say, I need for you to tell me what's going on with my body. New York Times. Now women are angry and confused because now there's a conflict in what should be done. I disagree with that. Women are not confused. It took 25 years for mammograms to be reimbursed. How long did it take to get Viagra reimbursed? 6 months. 25 years. 6 months. Recreational, sometimes therapeutic medication for sexual pleasure. 6 months. There's a disparity there. And I love this one. One researcher says, and when I see this, I say, have the strength of your convictions. If you are a researcher, identify yourself, tell us where you are so that we can validate what you're saying. And look how wimpy it is. The right answer is not always to start earlier, look harder, and look more frequently. But according to the Times, it may take decades for medical culture to catch up with medical science. What does that mean? Sounds like gobbledygook. We don't have to catch up with the research. We have to continue to find these diseases and treat them and improve the quality of life for women. Sometimes you wish you just had a silver bullet. Just one silver bullet that you could use to just eradicate all of this. But breast cancer illustrates how complicated care issues can be. So as a legislator, knowing all this information in the background, it is a challenge to make sure that the correct information is on the table. The challenges women face in addressing diagnoses and treatment issues, the last half of this presentation. We'll stay on breast cancer for a minute. These are the facts. 1 in 8 women will develop invasive breast cancer at some point in her life. 1 in 8. And this is from the American Cancer Society. With the exception of skin cancer, it is the most common form of cancer among women. Fact 3, some 40,000 will die this year of the disease, which is the second most lethal cancer in women, lung cancer being the first. Remember earlier I talked about lung cancer being eliminated? It hasn't. It's number 1. And the last fact, the chance that a woman will die of breast cancer is 1 in 35. Well, it's just 3% of the total women, but 1 in 35. How many of you have at least 35 female friends? Which one would you want to sacrifice? So let's take this example, patient A and patient B. This is actual breast cancer. These are the cells that kill. Which patient is under 40 years? A or B? Can't tell by looking at it. It's just as ominous. And in one case, it's even more ominous. Well, this is on an 82-year-old female. Earlier, we heard about the hormonal cycle. This woman is postmenopausal. She's elderly. She doesn't have a lot of hormones circulating. Right, doctors? Okay, I wanted to get some backup here. Got an amen corner. But this is breast cancer in a 38-year-old woman. 38. This case was in 2005. She was 38 years old. She found a little lump right at the bra line where the underwire touches the skin. She thought she had injured herself because sometimes the wire pokes into the skin. But it wasn't. It was a tiny lump, and it was cancerous. This is a woman who is at the peak of her hormonal season. So those hormones are feeding this tumor, and it's growing rapidly. But that task force said she wouldn't have to have a screening until she's 50. Ladies and gentlemen, she would have been dead. This is her tumor. It was a positive estrogen receptor test. All those little brown things, that's the tumor. And it's crucial in the success of 5-year survival rates in young women. She hadn't gotten to the 45-year mark, where magically you move from being a young woman to being a middle-aged woman. She would have died. I'm sure you could see the problem with that. Well, let me share a few more examples of problems that we have in medicine. So when we start talking about changing it, consider this. There's a system called the PICO system. This is an electronic registration system for Medicare. Okay. Medicare will deny payment to the testing physician who performs and completes a test requested by a referring physician. Now, it sounds a little backwards. Let me make it clear. The referring physician gets paid, but the referring physician is not registered in the PICO system. So a patient goes and has a Pap test. The Pap test goes to the lab. The lab gets the test, but because the referring physician is not in the system, the lab doesn't get paid. The pathologist doesn't get paid. If it's a breast biopsy, CT-guided procedure, the radiologist won't get paid. So what happens to these test fees and codes and charges? That patient ends up paying for it. Well, if it's a Medicare patient, where's the money coming from? They usually don't have it, which speaks to the reason why women end up with a huge debt load, because they can't afford to pay for the care. So we have all the ribbons that signify the various types of cancers. And it's truly a rainbow coalition. Each cancer with a different color. But they're deadly. Another problem, and this is the last example of this, and this doesn't make sense either. Medicare was denying this particular type of test, HER2/neu. This is a test that determines what particular chemotherapy will work for a cancer patient. Now note, in patients whose diagnosis is breast cancer, they have breast cancer. So the pathologist had to appeal to the medical director of the North Carolina Medicare intermediary. So they had to decide whether or not they were going to pay for a test that would determine whether or not they could perform a certain type of chemotherapy and if it would be successful. So in the infinite wisdom of the medical director, they agreed to pay for a diagnosis of breast cancer. And we wonder why people are up in arms when they say it's so simple to change the healthcare system and make it better. There are thousands of examples like this. So I want you to know that in doing all of these tests, think about your loved ones. Think about what's happening with healthcare today, and understand that as women and as men who love women, we cannot afford to be silent. Thank you for listening to me.